Today, the topic we are going to discuss is blood in stool. It is mixing of blood with bowel movements, making the toilet water red or streaking stool or toilet paper. Note that eating certain things can change the color of your stool. For instance, beets can turn stool red, while iron pills and bismuth, Pepto-Bismol, can turn stool black. On your patient visit, you will ask him about abdominal pain, changes in bowel habits or stool, mucus or pus in stool, pain with bowel movements, nausea, vomiting, heartburn, vomiting blood, bruising, weight loss, dizziness when standing, whether he has had a barium enema, proctoscope, or abdominal X-ray done in the past, and what they showed. On your patient visit, you will ask him about he or anyone in his family has had any of these conditions like hemorrhoids, diverticulosis, colitis, peptic ulcers, bleeding tendency, alcoholism, and colon polyps. On your patient visit, you will want to know if he's taking any of such medications like warfarin, adrenal steroids, aspirin, and anti-inflammatory drugs. You will do a physical examination including the following: blood pressure, pulse, pushing on his abdomen, checking his rectum for hemorrhoids, testing his stool for blood, thorough skin examination. Now let's talk about symptoms in adults. If a patient has rectal pain and light bleeding, he might have hemorrhoids or anal fissure, which is swollen blood vessels in the anus or rectum, or tears in the tissue lining the anus. If a patient has bright red stool and minimal pain, he might have angiodysplasia or diverticular disease, which is swollen, weakened blood vessels in the colon, leading to loss of blood. If a patient has black, tar-like bowel movements, vomiting, burning upper abdominal pain that is worse when lying down, sometimes relieved by food or antacids and made worse by aspirin or drugs such as ibuprofen. He might have ulcer, which is severe irritation of the stomach or intestinal lining. If a patient has low-grade fever, less than 101 degrees Fahrenheit, some pain in lower abdomen, blood may appear in stools, which are small and not well formed, sometimes weight loss. He might have ulcerative colitis, which is inflammation of the colon and rectum. If a patient has black, tar-like bowel movements, vomiting, upper abdominal pain and tenderness, he might have gastritis, which is infection of the stomach. If a patient has black, tar-like bowel movements, vomiting blood, jaundice, skin taking on a yellowish appearance, spiderweb-like collection of blood vessels near the skin surface. He might have esophageal varices, which is swollen blood vessels in the esophagus. If a patient has blood in stools, constipation, weight loss, and pain, he might have an abnormal growth of cells, may begin as a benign growth. Now let's talk about infants. If a patient has dark, tar-like stools, he might have swallowed blood, which occurs while breastfeeding or during delivery. If a patient has bruising, bright red blood, dark, tar-like stools, he might have excess bleeding hemorrhagic disease. Now let's talk about children. If a patient has red blood streaks in stool, he might have fissures or polyps, which is tears in the tissue lining the anus or benign growths. If a patient has bright red blood in stool, he might have constipation, which is inability to have bowel movements. If a patient has blood in stool with no pain, he might have Meckel's diverticulum, which is tiny pouch located on the wall of the lower bowel, a vestige from the umbilical cord and fetal intestines. If a patient has vomiting, decrease in bowel movements, abdominal pain, he might have volvulus or an intussusception, which is congenital shift in the position of the intestine, which sometimes leads to obstruction. So that was all about today. Keep following sqadia.com for more such videos.